Hello, and welcome to this session about having a physically active lifestyle. We will cover these subjects during this session: the benefits of a physically active lifestyle on pregnancy, recommendations for pregnant women, sexuality, and pregnancy. Despite the number of benefits prenatal physical activity has, a high proportion of women remain inactive or significantly reduce their level of physical activity when they are pregnant. In the province of Quebec, around 25% of pregnant women have a level of physical activity that allows them to enjoy the most associated benefits. Physical activity during pregnancy refers to the regular practice of physical exercises that work up the heart and lungs and that warm up and stretch the muscles. Outdoor activities, workout, dance, or simply walking with their partner. Active transportation and many indoor and outdoor household chores can let you feel the benefits associated with an active lifestyle. Before starting an exercise program, it is important to speak to your physician or midwife. True or false? I will be back on my feet faster after giving birth if I engage in physical activities during the pregnancy. True. If you are in a better physical shape, you will recover faster. There are many benefits to physical activity. A physically active lifestyle allows you to have a better mental health, improves your self-esteem, reduces the risk of prenatal depression and the severity of depressive symptoms. Have a better physical health. Reduces the severity of lumbopelvic pain frequently associated with pregnancy. Reduces the risk of urinary incontinence or the severity of symptoms. Helps develop and maintain muscles that are working harder during pregnancy. Helps prevent oedema and varix. Have a better metabolism. Helps prevent excessive weight gain, gestational diabetes, and pregnancy-related blood pressure problems. And finally, to improve the childbirth process, reduces the need for medical interventions, reduces the risk of cesarean section when physical activity is paired with a healthy diet. To improve your cardiovascular health, we recommend practicing moderate intensity activities that lead to mild shortness of breath at least 3 times per week, moving with a moderate intensity at least 30 minutes per day. 10-minute exercise sessions can also have positive effects. Avoid reaching excessive fatigue because the fetus requires energy. An activity that seemed easy before becoming pregnant will require a little more effort. Your heart will beat faster and your blood pressure will be a little higher. For people who have more of a sedentary lifestyle, starting with mild intensity physical activities may be necessary before progressively increasing the length and intensity of the exercises as the pregnancy advances. Here are a few suggestions that can help you do physical activities more often. Talk to your physician about your concerns regarding physical activities. Consult a healthcare professional, such as a kinesiologist, to have a safe physical activity program adapted to your physical condition and to your needs. Do pleasant physical activities that are easily integrated into your day-to-day life. Do physical activities with your family, your partner, or your friends. Social support has proven to have positive impact in breaking the barriers associated with prenatal physical activities. And importantly, do not feel guilty if you are unable to complete 150 minutes of moderate intensity physical activity. Do what you can and try to catch up on the amount of physical activity when possible. If the exercise feels too hard, regardless of how out of breath you are or how high your heart rate is, stop the activity and resume it at a lower intensity. In the 3rd trimester, the pressure of the fetus on the diaphragm can make breathing harder. It is important to adjust the intensity of exercises accordingly. Here are some examples of recommended sports and sports that should be avoided when pregnant. We consider that during a moderate intensity activity, the person should be able to speak but not sing. Women who do pelvic floor muscle exercises as soon as the 2nd trimester, between the 16th and the 20th weeks of pregnancy, are less likely to suffer from urinary incontinence towards the end of the pregnancy and immediately following childbirth. We recommend strengthening the muscles and improving your flexibility because it improves your posture, reduces lower back pain and urinary incontinence, lets you go back to your day-to-day activities that require strength and endurance more quickly after childbirth. When doing strengthening exercises, do not block your breathing. Doing this can cause an unwanted increase in blood pressure and should be avoided at all times, especially when pregnant. Breathe normally when doing exercises. During pregnancy, a hormone called relaxin softens and relaxes the uterus, the pelvic ligaments, and the pubic symphysis, which can make childbirth easier. However, it can also make articulations in the whole body softer, which means that exercises that demand a great range of motion, sudden changes in direction, or jumps should be avoided. Stretches should also be well controlled. Lastly, we do not recommend doing exercises while laying on your back after 4 months of pregnancy to avoid a reduced blood supply to the upper body. Exercises done while laying on your back must therefore be modified. It is important to listen to your body in order to know when to stop. Take the time to do relaxation exercises. Desire and the frequency of sexual relations can increase or lower during the pregnancy. Sexual desire can vary based on the stage of the pregnancy. Sexual desire can vary with your state of mind. Let nature take its course and listen to your desires. Talk to your partner and listen to them, because psychological and physical pleasures are experienced differently by each partner. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.